Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Federal government assures Nigerians the Oxford AstraZeneca vaccine is safe in spite of 53 moderate to serious side effects. Association of Medical Laboratory Scientists of Nigeria decries being left out of health worker welfare talks, vows to reject negotiation outcome. And World Health Organization warns the pandemic is far from over, expresses concern over rising number of COVID-19 infections and new deadly variants. Last night, 80 new cases were confirmed in Nigeria, putting total figures till date at 164,080. 154,285 cases have been discharged and the death toll unchanged at 2,061, recorded in 36 states and the Federal Capital Territory. The 80 new cases are from 12 states, Lagos recording the highest 29, Rivers 19, Zamfara 6, Akwa Ibom, Edo, Osun, Plateau, Ogun 4 cases each, Kano, Nasarawa 3 each, the FCT 2, 1 in the FCT rather, and 1 in Oyo. According to the NCDC, Plateau, Niger and Kogi have 0 cases on admission, while Nasarawa, Ondo and Adamawa states have the highest number of patients with COVID-19 on admission. According to the NCDC's latest epidemiological report of the 5th to the 11th of April, the highlights for the week 14 shows that the number of new confirmed cases has decreased to 598 from 602 reported in the 13th week. These were reported in 12 states and the FCT. The same week, the number of discharged cases increased to over 2,000 from 1,690 also in the previous 13 week. Well, these were reported in 18 states and the FCT. The number of reported deaths in the last 1 week was 2 from 2 states. So far, case fatality, CFR, stands at 1.3%. The number of inbound international travelers at Nigerian airports was 17,009 compared with 19,005 in week 13. The number of international travelers with a positive result was 44 compared to 42 from week 13. And globally, the count for confirmed coronavirus cases is over 135 million, with over 2.9 million deaths, resulting in the case fatality rate of 2.2%. The federal government is again assuring Nigerians of the safety of the Oxford AstraZeneca vaccine, despite recording over 8,000 cases of adverse effects following immunization in the country, 52 of which were from moderate to severe cases. At a joint press conference of the National Primary Healthcare Development Agency and the World Health Organization in Abuja, the DG of the National Primary Healthcare Development Agency states that over 1 million Nigerians have been vaccinated so far, of almost 4 million vaccines given to the country. And the states with the highest number of adverse effects following immunization are Kaduna, Cross River, Yobe, Kebbi and Lagos states.
AFI, it's an acronym for adverse events following immunization. And I categorized them into those that were mild. There are about 8,439 of these across the country. And then there are those that are moderate to severe, that are about 52. All of them are adverse events following immunization. We should also recognize that there are different background rates when it comes to the incidence of blood clotting. So typically, what the literature shows is that Africans are less likely to experience blood clotting disorders, right, compared to Caucasians. Maybe this is also contributing to why we're not seeing blood clotting after vaccination in Nigeria. But that notwithstanding, we cannot let our guards down. We have to continue the process of getting the reports on side effects and investigating them to make sure that this blood clotting, this very rare blood clotting, is left identified and investigated in Nigeria.
In the meantime, the country director of the World Health Organization commended Nigeria for the early vaccine rollout, noting that the benefits of the AstraZeneca vaccine far outweighs the risks.
It's important that whenever you experience those symptoms, you refer to the health workers who can then investigate and roll out. There may be some other procedures to confirm whether it's a blood clot or not. But if you don't report to the health workers, then it's difficult to find those blood clots. But I agree with ED that it's very context specific. Talking about the vaccine equity, WHO is currently engaged with the G7 and G20 to try and increase pressure on those countries who are holding the vaccine so that they could redistribute the doses and make them available through the COVAX mechanism or through bilateral agreement to countries that need them the most. WHO is also engaging the manufacturers for technology transfer so that we could have more sites that could manufacture the vaccine in order to scale up production.
Well, for more on the vaccinations across the country, joining us is Dr. Anne Jean-Baptiste, Medical Officer, WHO Nigeria, COVID-19 Vaccination Pillar Lead. We'd like to thank you for joining us on the program. She's joining us via Zoom.
Thank you for having me.
First, how would you assess Nigeria's pharmacovigilance to the vaccines already deployed?
Prior to the COVID-19 pandemic, the NAFDAC, the National Authority for Food and Drug Administration Control, has been implementing a passive pharmacovigilance in Nigeria. They use a yellow form that the health workers needed to fill and submit to WHO monitoring centers. This is basically to analyze the outcome, to analyze the cases, let me put it like this, and also to trigger alert and provide feedback to countries. During the vaccination campaigns that we usually do, the measles campaign, yellow fever, there was also follow-up on adverse events following immunization, so the AEFI. So in 2020, NAFDAC upgrade the reporting system by developing Med app, the Med Safety app, and the AEFI form was also included to this Med Safety app. So Nigeria is really on track. The health workers are well trained on AEFI, and the reporting system is really ongoing.
So we've heard of the COVID-19 AstraZeneca vaccine and, the Johnson & Johnson, the thromboembolic events, blood clots. Health experts continue to say that the benefits overall outweigh the risk, but it doesn't change the fact that some people have died from trying to protect themselves from COVID-19. What do we know about the definite cause of the clots or specific risk factors?
Several further investigation is needed about the blood clots. What we know so far, in the case of AstraZeneca vaccine, those that were affected, they tested positive to a type of antibody that bind to a molecule produced by the platelets. This is the PF4, and the vaccine may have somehow triggered the release of these antibodies, which is the main cause of this blood clot in those cases. For the Johnson & Johnson, it's really low numbers of cases. When you look at it, only 6 cases of blood clots were reported out of the 6.8 million people that were vaccinated with the Johnson & Johnson. Again, there's a need to have further investigation, so the science needs to confirm that there's really a causal link, whether there's a causal link with the blood clot and the vaccine per se. But what we can say, and we are continue to saying, is the benefit of the vaccine outweigh the potential risk. WHO continue to support country and encourage country to continue the rollout of the COVID-19 vaccine. As at today, I can say that there has been over 190 million doses of AstraZeneca vaccine that has been administered worldwide. And we know that the vaccine is really safe, has been saving life, and also protecting against several illness.
So amongst the third wave some countries are facing, and, you know, the situation in Africa, I mean, WHO, for example, is warning of possible surge in infections, and this is in the month of Ramadan. And we know that majority of vaccines in Africa are from the COVAX facility. Is there any hope to getting more vaccines? And really the question a lot of people are asking is when?
That's an excellent question. As you know, let me take the example of India. India is the one, the institute, the Serum Institute of India is the one that has produced the AstraZeneca vaccine that we are using in Nigeria currently. And you know that India is experiencing a really increased number of the cases and the death in India. So far, the Indian authorities are reporting that less than 2% of their population has been vaccinated. You can understand that countries are trying to protect their own population first. But that said, you know, WHO is working with the global community, is working also with the manufacturers, working through the COVAX facility to see how we can get more vaccine available, especially in Africa, in the context of getting equity.
All right, finally, what's your perception about the virus trend now with the sort of low numbers being recorded every day? Nigeria Center for Disease Control, are we on top of our surveillance of the virus in the country?
That's again an excellent question. What we can say is, yes, the number of tests has been decreased, but the test positivity rate, which is the infection rate, has also significantly decreased, which is currently less than 5%. And this is an indicator of low transmission rate.
All right, we'd like to thank you. Seems we're getting things right here in Nigeria. Thank you so much, Dr. Anne Jean-Baptiste, Medical Officer, WHO, Nigeria COVID-19 Vaccination Pillar Lead. Thank you for joining us on the program.
Thank you again for having me.
And for the 18th time, the Imo State Governor is cautioning citizens of the state not to reject the vaccination program. Senator Hope Uzodinma insists that the AstraZeneca vaccine is safe, remains the only hope of immunity against the dreaded coronavirus disease. The governor disclosed this in a recent broadcast to Imo residents in the state capital, Owerri.
On March 11, 2021, the Imo State government received 80,720 doses of Oxford AstraZeneca vaccine at the Sam Mbakwe Airport in Owerri. Days after, the state government flagged up a vaccination program where the Imo State Governor Hope Uzodinma, his wife, the Deputy Governor Professor Placid Njoku, and other top government functionaries received their jab of the Oxford AstraZeneca vaccine. In a broadcast to Imo people, the governor reiterates the need for residents of Imo State to take the COVID-19 vaccine as it remains the only hope of immunity from the dreaded coronavirus disease.
COVID-19 vaccine is completely safe. This is the only hope of immunity from the dreaded virus. And I'm assuring you that it is not in any way harmful. I have taken it. My wife has. The deputy governor and his wife have also taken it, and nothing has happened to any of us. My beloved Imo people, your safety and well-being will always remain the focal points in the agenda of our administration. This explains why we have not relented in not only ensuring that you are safe from COVID-19, but also in ensuring that we recorded substantial improvements in infrastructure and general development.
He wants, though, that people, both those who have received the jab and those who haven't, still have to keep non-pharmaceutical protocols.
Let all of us observe all the COVID-19 protocols, especially social distancing and wearing of face masks.
Although residents are responding to government's call to take the vaccine, the state government says there is need for more people to show interest. Channels Television News.
So ahead on the program, we take a look at Europe and around the world, other countries, the rising cases there. Stay with us. The Association of Medical Laboratory Scientists of Nigeria, they're accusing the federal government of reneging on its promises to providing better welfare and conducive working environments for its members during the wake of the coronavirus pandemic. The association maintains that laboratory scientists have been abandoned by the government after giving their all in fighting the virus. Members of the association also fought their exclusion in the ongoing negotiations for a new hazard allowance for health workers.
In the wake of the pandemic, the medical laboratory scientists showed their undying compassion for the patient by walking the path dreaded by many. While some were stigmatizing, the medical laboratory scientist was on the search to collect samples from those who others feared to come close to. They indeed provided the needed specimen that guided public health action. It is, however, pertinent to note that despite the numerous roles being played by these noble professionals, a lot is yet to be done in giving due attention to their yearning and desire of this profession. And to even make matters worse, Senator Dr. Chris Ngege convened a meeting of unions and associations to negotiate on hazard allowances to be given to health workers. And if you look at it, we are the one that is even more exposed to dangers than others. But we don't know why he decided to exclude us from that negotiation table. And as far as we are concerned, anything that is done without our participation, we will not accept any resolution that will come from that negotiation, and we will resist it. We will use all the powers that we have to resist it.
Away from Nigeria, German Chancellor Angela Merkel has urged the country's parliament to support a slate of tighter public restrictions as new COVID infections continue to climb. Merkel asked lawmakers to forgo any half-heartedness in the fight against a third wave of the pandemic, which she said had Germany firmly in grip. Germany recorded more than 25,000 new infections Friday as the British variant surges through the country. Deutsche Welle correspondent Stephen Biazzi joins us now from Berlin for more. Hi, Stephen. How are health experts describing the situation?
Well, experts here have really insisted upon the inevitability of this third wave. They've been saying it for months now. They've been saying that it's coming. And they've had a good look at it in the UK, where that British variant really ripped through society there and forced a much tighter lockdown. The continent has been expecting for some time that it was going to come. We saw it first in France and Spain and other countries. Germany was a little bit slower to pick up, but it has picked up. We saw 25,000 new cases today. We saw 30,000 new cases yesterday. More than 90% of those new cases are that British variant. So it is happening. There's also really been an insistence on how infectious this new variant is. So for a public that may think that it knows already the rules, that this is something of a game changer. So don't expect that you know everything already. There's also been officials have pointed to basically that younger people are getting hit more by this than older people. That may have something to do with vaccination rates already. Also the fact that it is a variant. And they've been pointing to the decreased availability of intensive care beds. That's, of course, a critical factor across the country. There is still a good number of intensive care beds available, but we're seeing that in some communities, hospitals are reporting that they have less and less available. So that is the message that they're sending. The difficulty is going to be persuading a public that is that has fatigue naturally, like in many countries around the world, that has fatigue from more than a year of this pandemic, and already what they believe, having curbed their behavior during that time.
Will Merkel succeed in tightening measures?
Merkel is today hearing some fierce debate from both sides of the political spectrum. We know that on one side there are criticisms of this curfew in particular, with the Liberal Party, for example, saying that it is against the Constitution, that they could even file a constitutional challenge if this measure goes through. On the other side, the Green Party, more on the left-hand spectrum, has been saying that there should be a stronger requirement that employers test their employees. That should be an ironclad requirement before employees can go into the office. despite this kind of opposition to certain parts of the measure, I do expect that something will be passed. Surveys continuously show that a majority of Germans do expect and do want tighter measures to be put into place. They do recognize that the third wave is there. At the same time, naturally, there are some concerns about what that means for public life.
And finally, Stephen, I mean, with the vaccinations ongoing, is there any hope in terms of the progress?
Yeah, there is reason to be more optimistic about vaccines, at least in the last few weeks. We've seen on Wednesday, for example, that there was a record set with vaccination, 740,000 in one day. That's reason for good news. We've known all along, public officials have been saying that it was going to really pick up in the second quarter, beginning in April, and really hitting momentum in May. There have been more questions about that, of course, because of AstraZeneca. The restrictions on AstraZeneca really limit the number of people who can get that. And then with Johnson & Johnson curbing its deliveries or sort of postponing them, that could be problematic. On the flip side, we have seen good news from Pfizer, for example, which has said that it will produce and deliver more vaccines in this quarter than it had expected, and that leaves some cautious optimism that the EU and that Germany will still hit those vaccination timelines that they had set. That is in Germany, that everyone would have a chance to receive a vaccination by the end of summer, about September 20th. So some good news there. We're also seeing a bit more flexibility from some states saying, hey, you know, AstraZeneca may be limited, but those who want it can still get it.
All right, many thanks, DW correspondent Stephen BSD there. Thank you for that update. Stay safe. Now, the World Health Organization says the rising number of COVID-19 cases around the world are quite worrying, as number of cases per week globally has nearly doubled over the past 2 months. Director General of the Global Health Agency says he is concerned about a surge in cases in Papua New Guinea, warning that it could lead to a much larger epidemic. The country has so far reported more than 9,000 COVID-19 cases. Here's more on the global update.
German Chancellor Angela Merkel has received her first shot of AstraZeneca COVID-19 vaccine. She later posted on Twitter, "I am happy that I received the first vaccination with AstraZeneca. Vaccinations are the key to overcoming the pandemic." Germany's vaccine regulator has recommended limiting the use of AstraZeneca vaccine to those aged 60, citing risks of a rare clotting condition. Rome cemeteries are running out of space to store coffins ahead of funerals, as a backlog in services due to COVID-19 restrictions has slowed down the pace for burials. Large refrigerated containers that cemetery workers said were holding dead bodies were seen outside the Prima Porta cemetery in the capital. They're usually only inside cemeteries, but with the cemeteries around the city at full capacity, the surplus bodies are in the containers outside. India has extended a record daily run of new COVID-19 infections today, spurred by hundreds of positive tests at a major religious gathering, as politicians pushed ahead with election rallies against advice that could worsen the outbreak. The health minister, Harshvardhan, visited coronavirus patients at a local hospital ward and later commented to the media that India learned from its experience of fighting COVID-19 over the past year.
We might be able to get back to having our liberty.
Finally, a congressional hearing on the coronavirus pandemic became heated in the United States after Republican Jim Jordan repeatedly challenged infectious diseases expert Dr. Anthony Fauci for a timeline and an end to public safety measures. Jordan demanded to know when Americans could get their liberty and freedoms back, and in response, Fauci said, "I don't look at this as a liberty thing, I look at this as a public health thing."
Church, people can't assemble in their own homes with their friends, with their families. People can't go to a loved one's funeral. People can't get to their government, petition their representative to redress their grievances. Right. I also understand the First Amendment's pretty darn important, and it's been a year, and I want to know when Americans will get those First Amendment liberties back.
You're going to see a gradual right now we're at an unacceptably high level. On a daily basis, it's unacceptably high, regardless of who you are. What you're going to see as more and more people get vaccinated, and we get over 3 million people a day.
Around the world, more contagious variants of COVID-19 are spreading, and a lot of people are still very vulnerable. Don't forget to protect yourself, continue to take responsibility. For more updates, a better understanding of the pandemic, you can take a look at our website. It's channelstv.com. You can find all the stories there as well. Thank you for watching the program this evening. I'm Millicent Nwaka. Stay healthy.